A stomach ulcer, also known as a gastric ulcer or peptic ulcer, is a type of sore that forms on the inner lining of the stomach or the upper part of the small intestine, duodenum. It is characterized by a breach in the mucosal layer that protects the stomach or duodenum from the acidic digestive juices. Here's a detailed overview of stomach ulcers. Causes: stomach ulcers primarily develop due to an imbalance between the protective mechanisms of the stomach and the damaging effects of gastric acid and digestive enzymes. The most common causes include Helicobacter pylori infection. This bacterium is a major cause of stomach ulcers. It weakens the stomach's protective mucus layer, making the underlying tissue more susceptible to damage from stomach acid. Non-Steroidal Anti-Inflammatory Drugs, NSAIDs. Long-term use of NSAIDs, like aspirin, ibuprofen, and naproxen, can irritate the stomach lining and increase the risk of developing ulcers. Smoking. Smoking increases the risk of ulcers and can interfere with the healing process. Excessive alcohol consumption. Heavy alcohol consumption can irritate and damage the stomach lining. Stress. While stress alone doesn't cause ulcers, it can exacerbate existing conditions. Symptoms. The symptoms of a stomach ulcer can vary in intensity and may include burning pain. The most common symptom is a burning or gnawing pain in the stomach area, often occurring between meals and during the night. Nausea and vomiting. Some people experience nausea and vomiting, which can be worsened by the pain. Loss of appetite and weight loss. Due to the discomfort, individuals may have a reduced appetite, leading to unintentional weight loss. Bloating and burping. Experiencing excessive bloating and burping after meals is also possible. Dark or bloody stools. In severe cases, bleeding from the ulcer can lead to black, tarry stools or blood in vomit. Diagnosis. Diagnosing a stomach ulcer involves several methods. Endoscopy. A thin, flexible tube with a camera, endoscope, is inserted through the mouth to examine the stomach and duodenum lining. Upper GI series. X-ray imaging is done after the patient drinks a contrast solution to highlight any abnormalities. Stool test. Detecting the presence of H. pylori bacteria through a stool sample. Treatment. Treatment for stomach ulcers typically includes a combination of approaches. Antibiotics. If H. pylori infection is present, a course of antibiotics is prescribed to eradicate the bacteria. Acid-suppressing medications. Proton pump inhibitors, PPIs, or H2 blockers can reduce stomach acid production and promote healing. Discontinuation of NSAIDs. If possible, discontinuing or reducing the use of NSAIDs can aid in healing. Lifestyle changes. Quitting smoking, reducing alcohol consumption, managing stress, and making dietary adjustments can help prevent further irritation. Complications. If left untreated, stomach ulcers can lead to severe complications such as internal bleeding, perforation, a hole in the stomach or duodenum wall, and increased risk of stomach cancer. It's important to note that while many stomach ulcers can be managed and treated effectively, medical guidance should always be sought for proper diagnosis and treatment.